This afternoon, I'm joined by Police Chief David Smith, Dr. Shirley Green, our Commissioner of the Department of Recreation and Human Services, Aaliyah Hinton-Williams, who's our Manager of Crisis Intervention Services, and my advisor on Violent Prevention Services, Dr. I almost called Dr. Victor Saunders. Victor Saunders. So today, as you know, we've done these updates from time to time. I want the Chief to give us a high-level update. As you know, the state of emergency is still in effect, and I want to give the Chief the opportunity to give some numbers that will be out. We are approaching my 11th month in office, so 11 months has gone by. This has been a particularly tough past 2 weeks as it relates to some things, but as we start to get to the end of the year, not only are we looking to reflect back on the numbers as they are, but also to talk about charting the path to the future. So I want the Chief to first give an update on our suppression efforts, and then I'll come back and make some comments and turn it over to the rest of our folks. So Chief.
Try not to get my pages mixed up, but here's Mayor.
Yes.
As the year 2022 has progressed in an effort to reduce violent crime in the city of Rochester, the Rochester Police Department has implemented several new programs and expanded our efforts into others. This includes the Rescue Our City initiative, the redevelopment of the GIVE program, and significantly increased federal partnerships. The Rescue Our City initiative began on June 15th of this year and was expanded on August 1st. This was a coordinated effort throughout the summer that involved local, state, and federal partners that targeted known top-level firearm offenders. A key part of this partnership has been the Bureau of Alcohol, Tobacco, and Firearms. This partnership with the ATF has expanded into same-day evaluation of most appropriate prosecutorial methods for all firearm-related offenses. Since the beginning of this initiative in June, 64 firearm-related offenders have been charged by the ATF and entered into federal prosecution. To date, 48 of those offenders remain in custody. It should be noted that during these targeted arrests, there were 0 officer injuries, 0 suspect injuries, and no personnel complaints. The United States Marshal Service was also a key component of this initiative and continues to be instrumental in tracking down our most violent offenders. As we move into winter, the GIVE program, gun-involved violence elimination, has been retooled and refocused to highlight specific street segments and case-of-place problem-solving hotspots. This includes not only targeted enforcement, but a deeper dive into the cause of violence at these locations and preventative measures that can be taken. Our partnership with Pathstone continues to expand with the addition of a mental health clinician focused on violence prevention, funded by the GIVE initiative. Our partnership with Monroe County Sheriff's Office has also increased, and we're extremely grateful for the 12 deputies that are being assigned to the city on a daily basis. That leads us to the question of what has all this translated to in relation to violence. Tragically, we have just reached our 72nd murder of the year, which, although lower than the 76 at this time last year, is still unacceptably high. Especially being that 58 of this year's murders were using a firearm, or roughly 10% increase over last year. Overall, though, shootings and shooting victims are down from last year. Shooting incidents are down approximately 12%, and the number of shooting victims is down approximately 16%. For the month of October, the city of Rochester had 19 shooting victims, compared to the previous October where we had 28. Although these violent crime numbers are mostly trending in the right direction, we know it is never enough, and we are continuing to work towards lowering those numbers even more. We currently have 24 recruits in the academy and are planning another class in the spring. Tomorrow, we meet with local and federal leaders about the launch of our membership into the Public Safety Partnership Program. The Public Safety Partnership Program is a national program sponsored by the Department of Justice that brings together law enforcement agencies from across the country into a coordinated partnership. We will be announcing more details about this partnership in the coming days and weeks. Although these local and federal partnerships are a great asset to our community, ultimately is the dedication of the men and women of the Rochester Police Department that is the key component to making our city a safe place. Thank you.
Thank you, Chief, for those highlights. Obviously, we will give a full year update, but as we know, as I've always said, one homicide is too many, but it is also important to highlight the facts. Shootings are down, shooting victims are down, and we want to continue on that trajectory. But today, I also want to focus on something that is near and dear to my heart and very important, and that's trauma. That trauma that stems from and often feeds violence. So this past Saturday night shooting death of a 27-year-old man in the presence of his child and another child, ages 7 and 8, offers yet another painful, stark reminder that in our community, violence and trauma are inextricably linked. And if we're going to break the cycles of violence that are plaguing our streets, we have to confront the cycles of trauma that are plaguing our children and families. You know, as a father of 2 young sons myself, my heart breaks for these children and their families, and all the children and families in our city who are being drawn into violence. And some of this, as I said, is cyclical. Beefs that have not been squashed and kids being caught in the crossfire. No child should be forced to experience this level of trauma, and our entire community must do all we can to heal. I want to give a special thanks and commend the men and women of the City Crisis Intervention Service Unit who immediately responded to be with these families in those critical first hours of this shocking event. As is the case following all homicides, trained social workers provided these families emotional support and access to services to help them recover. While there is no excuse for the depravity displayed by those who commit such heinous acts of violence in the presence of these children, their complete lack of empathy and compassion is clearly the result, many times, of their own past trauma. And we as a community must redouble our efforts to confront and reverse this reality. And we know that left untreated, trauma often perpetuates more trauma, and that often leads to violence that perpetuates more violence, along with a wide range of negative social outcomes associated with crime and poverty. And that is why the current city budget includes funding in more than triple of the number of emergency response social workers in crisis intervention services. But the city cannot end this dynamic alone, and that's why we call on everyone in our community to help us stop these tragedies that we are seeing. And I'll tell you, this is not really a city role. The county runs mental health services, but we understand very clearly that the city has to be involved in mental health services, and that's why we have invested in those things. And I'm calling on all of our communities, human service agencies, houses of worship, and all people of conscience to be a part of this effort to continue to end the cycles of poverty. I want to thank so many folks in the broader community that have stepped up and helped to try to stop this poverty. And consider the broader circles of innocent victims whose lives are forever changed by each incident of violence that we have seen in our streets. We can all be a part of the effort to help them and the entire Rochester community find a path to healing. But it's unacceptable when innocent children are being caught in the crossfire because adults are making decisions that children had nothing to do with. And we've seen that too often here in the city. We saw it last year, where a mother was gunned down by an apartment complex with her kids in the backseat. We saw it on the west side of the city earlier this year, where a father was gunned down with kids in the backseat. We saw it when a 10-year-old kid was braiding her grandmother's hair and bullets came into the house. So we've seen all of this, and kids have to carry this with them. They're very resilient, but we want to say that there is support out there. And I want to have Dr. Shirley Green and Aaliyah Hinton-Williams talk about the services that we want to push out to the community. Many folks know about these services, but we want to highlight them, particularly during this time of the holidays. Thanksgiving is next week. You're gonna be spending a lot of time with family members. Some of you are probably happy to see some of your family members, some of you probably not so much. I'm happy to see my family members, most of them. But therefore, it's important for us to remember in this community, there's a lot of people who aren't gonna have a family member sitting at the Thanksgiving table or under the Christmas tree as they open gifts, because they were gone as a cycle of violence. And there's some little kid that's gonna be looking around, they're not gonna see their mom and dad around. Or there's a mother who's gonna be wondering, she's gonna go to her son's room to tell him Happy Thanksgiving, and he's not gonna be there. And that all leads to isolation, it leads to loneliness, and it can lead to anger, which can often result in violence. But I'm here to tell you that we have resources in the community. We have resources in the community to help deal and cope. It may not take everything away, but we can help cope with the challenges that we're having in our community, and this trauma that so many people have seen. So I want to have Dr. Green and Aaliyah Hinton-Williams talk about the resources that are out there, give the numbers that people can reach out to get help with this situation.
Thank you, Mayor Evans. Good afternoon. The Department of Recreation and Human Services continue to work to address trauma throughout the city of Rochester. And this is focused within our Crisis Intervention Services unit. This unit consists of 3 teams: the Homicide Response Team, the Person in Crisis Team, which is known as the PIC Team, and the Community Support Team. The goal for this unit is to implement comprehensive community-based response, support, and resources to those affected by crisis, trauma, and crime. Today, we kicked off our community support drop-in services, which are located at 2 churches, one in the 14605 area and one in 14611. And this is an effort to create safe and neutral spaces for residents to come and seek support and additional resources from our crisis intervention services. I'd like to introduce our manager of crisis intervention services, Aaliyah Hinton-Williams, who will speak to you a bit about what each of these teams has been doing to support our families during these crisis intervention times. Aaliyah.
Good afternoon. I would first like to again offer my condolences to the families who have lost their loved ones over the past week. My heart truly understands and grieves with them, and we are also extremely concerned for the children who were present at the homicides. Additionally, we send our thoughts and prayers to all of our community families who have lost loved ones in 2022. To familiarize some and refamiliarize others, again, the Crisis Intervention Services Unit has 3 components under its umbrella. As Dr. Green stated, the Homicide Response Team, the Person in Crisis or PIC Team, and the Community Support Counseling Team. All 3 teams are intentionally intertwined and work collectively with the support of our Mayor and Commissioner Green to provide support to our community when they are faced with crisis, trauma, and tragedies. The Homicide Response Team is a team that includes myself, a staff social worker, a community partner, and the Clergy Response Team that responds to every homicide scene, whether that's on the street, whether that's at a home or at a hospital. If it occurs in the city of Rochester, the Homicide Response Team will respond. Our sole purpose at that time is to help our families navigate through one of, if not, the most horrific tragedy they will ever experience. On scene and following the incident, we provide emotional and mental support. We work with and rely heavily on our strong partnership with the Rochester Police Department's Major Crimes Unit to help families understand what is happening, what the next steps are, and answer questions about their new reality. We use the RPD's mobile unit to provide privacy and seclusion and allow investigators to speak with the families. We also then provide connection through our own community support counseling team and our various community partners to make sure needs are met for families, including financial, counseling, housing, and other supports. Our work is extremely person and family centered. Each case is different, and it is our responsibility at the Crisis Intervention Services Unit to ensure that each family gets what they need. There is much intense follow-up that occurs after the initial date, and our 3 teams, including our counselors and the PIC team, provide that follow-up for as long as it takes to help families reach stability. There is much work that occurs outside of the scene that many are not aware of and do not see. The Crisis Intervention Services Unit is a 24-hour unit. We do not close, ever. Our teams work tirelessly around the clock to support families. We are committed and we work from the heart as many of our own team members share a connection with victims, which enables us to provide a service which is genuine and compassionate. 3 teams are working because we know that intervention and assistance must happen so that our community can reroute community trauma. Thank you.
Thank you. And anyone needing those services should call 428-6630. 428-6630. And then obviously we also have, 311 for folks that they also can call. So thank you, Aaliyah and Dr. Green. And I would like to have Victor Saunders to the podium to talk about how his violence prevention team is aligning with this work to engage those who have been impacted by trauma and may be tempted to act out in unproductive ways. I always tell people, think about it. Think about if you are a child and you witness someone perpetrating a violent act, what that does to your psyche as you grow, and the anger that you may feel if you know that one of your loved ones was taken away, or the isolation and loneliness that you feel. We want to say to the community that we want to push people to these services, particularly now during the holiday season, because this is when I think for many it sinks in, and when it gets really hard, it gets even harder. It's hard throughout the year, but holidays are when families usually come together, and when family members are missing, it brings something up into a person's mind and can really, really have a deep effect on them. So we want to make sure that we do everything we can to help provide those services and support in the best way that we know how. So, Mr. Saunders.
Thank you. Good afternoon. First and foremost, my heart goes out to the recent victims of violence and the children who had to experience those horrific events. Violence is absolutely connected to trauma, and trauma is absolutely connected to violence. I believe a lot of people who experience traumatic events haven't had the opportunity to receive the help necessary to help them cope. Addressing mental health in the community has been a concern, has been for some time, and the pandemic didn't help. The world shut down, and many people were left in traumatic situations and never received help for those same situations. Now you add illegal firearms, and we have a very dangerous situation. You may have heard, the saying, hurt people hurt people. It sounds cliche, but we have to address the hurt that a lot of our people in our community are walking around with that is leading to the violence that we're seeing. Our Pathways to Peace team are impacting young lives each and every day, one by one in the community. They visit households, provide conflict resolutions, intervene in disagreements, and help facilitate reconciliations between individuals who have disputes. And with the help of the mayor and Rochester City School District, we have increased our Pathways to Peace team in the city school district in order to be able to help more young people who are dealing with traumatic events. The Pathways to Peace office can be reached at 314-8666. It's 314-8666. Our violence intervention teams, along with Pathways to Peace, the Office of Neighborhood Safety, and the Peacemakers Fellowship, work closely with other community partners that work to address unresolved trauma. We work with Rock the Peace, SNUG, Rise Up Rochester, local pediatric psychology professionals at local hospitals and other organizations that specialize in addressing the violence and the resulting trauma. In fact, in the next 10 days, we'll be announcing the organizations that will receive funding as part of the Rochester Peace Collective, to which the city is committing a $5 million investment. We're excited, hopeful, and anticipate that these organizations and agencies will assist with mental wellness and violence reduction. Thank you.
Thank you, Mr. Saunders. So again, as we head into the holidays, we want to make sure that folks avail themselves of these resources that we have made unprecedented investments in our community and in our city. Now more than ever, it's important that we direct those resources. So I'm hoping that our friends in the media can put out that information. Obviously, that information will be on our website, and we continue to share that information with our community partners as well. That's critical. Just again, on the public safety front, we will review in a couple of weeks whether or not we will continue our gun violence state of emergency. But as you can see from the results that the chief outlined very early on, we are seeing some results of that. We are not where we are, but thank God we are not where we were. We have a lot longer way to go, but we are pleased with some of the results that we are seeing. But I will tell you, as I always say, one shooting, one homicide is completely too many, and it makes it even more too many when they are over stupid things. And I don't have a clinical or a big monosyllabic word to use other than stupid, because that is what most of the homicides that we have seen this year have been over. It's not been over anything such as, something important. It's been over things that are not important, and people have paid the price for it. So with that, I have time for a couple of questions that we will take. So if anyone have questions, please feel free, and I'll take them. Yeah.
So Mayor Evans, you mentioned the man ambushed in his driveway in front of his kids and shot to death. We just had 2 young boys inside the home where the mother was gunned down in front of and killed. We will not be spending Thanksgiving with their mom. What is your response to that as a father?
I think, first off, it hurts your soul because you wonder how they could ever get that out of their heads. How do you erase that? You can't erase that level of violence, that level of trauma. And it makes it even worse when it's a parent and you know that there is very little that you can do because you probably are not even old enough to be able to get up and unlock the door. I think about my own kids who are so little that has to stand on the counter to go and grab the boxes of cereal. I mean, these are young kids that won't be able to spend Thanksgiving or Christmas with their kids, with their parents. The incident the other day was an absolute tragedy. To have that happen with kids within an earshot, to see that. But I think that what we have to do as a community is to make sure that we really wrap our loving arms around the families that are experiencing these situations. And this is why the work that Aaliyah and her team are doing is so critical and important. It's just not us at the city, there's people across the community that are doing this, and Mr. Saunders mentioned some of those organizations. It is critical that we get people connected. Because like I said, you can't go back. Yep. Next question,
Did you want me to?
Garcia,
Yes.
right? That's your name?
Yep. Isabel?
Good, I'm learning everybody's names.
Yes.
You guys change around so much, it's hard to remember all the names.
Yeah. Yep. Isabel Garcia from News 8. Just looking to see, and it seems like much of the conversation has been, surrounding focusing on the youth. What is the community's responsibility and the adults' responsibility to help facilitate change and just making that shift of what has now seemingly become acceptable?
I think that the community has to say that. I think the community has to be able to say enough is enough, right? And particularly, the community has to say that we are not going to. I think when I'm seeing a change in, which I'm happy about because I track the calls that come into the mayor's office, that if someone sees a drug house now, I think people were afraid to speak up. If they think that someone has a firearm, they think that someone is in trouble, there is a lot of fear in the community. But we are seeing a lot more people saying, I've had it. I'm not gonna. So yeah, I may live in one of these neighborhoods that might be tough, but it's still a neighborhood that I live in. And even though it may be a tough neighborhood, people live here, and we're not going to tolerate that. And I've been so heartened by the members of this community that have said, Mayor, first off, we got your back. If you go do something about it, we're going to stand shoulder to shoulder with you. And I think that is what we are seeing a lot in the community. I think you don't hear a lot from these people because you know why? They don't come to city council meetings because they don't have time. They don't come to city hall because they're busy taking their kid to soccer practice. They're working 2 jobs. They're trying to get their house ready for the winter. All those things. But you know what those people are saying? They're saying they're sick of it. And they don't want it in their neighborhood. And I think that just by them speaking up more and more, in which I'm seeing, I'm feeling it, and that's why I'm going to work for Rochester on behalf of that. I think that has been very helpful. So I think that the community has to continue down that path, and I've been very proud in the last 11 months to see so many members of the community call, and sometimes they won't leave their name. I mean, I've been out there, they say, hey, you may want to check out such and such an address, or this person is doing that. And people are also reaching out for help. The hardest part of my job has been talking to families of homicide victims who just wants to call the mayor's office just to tell me about their family member. That really energizes me to let me know that we have, as a community, a lot of work to do to make sure that another family doesn't have to go through that. And almost every family says that to me. I don't want what happened to my kid to happen to someone else. But I think overall, I think the community's responsibility is to continue to speak up, continue to find ways in which you can be supportive. It doesn't mean anything huge. Just if you see something, say something. But more importantly, also making sure that you're aware of what people that are in your control are doing. Not just your kids, but your family members. If you see them being angry or looking like they're going to act out, try to get them to intervene. Or if they're talking about wanting to get an illegal firearm, which will alter the trajectory of their life, whether or not they kill someone or not, working to try to be able to intervene in that. We have so many resources in this community that we want people to be able to use. The coordination may not always be as great, and I think we're improving on that, but we got to make sure that and this is why we do these briefings regularly, because we want to let people know what is out there. And then we want to talk about what's not working. So what's not working, the ideas. I mean, we change all the time based upon feedback that we get from people. And I think that that's very important.
Can I do just a quick follow-up, if that's possible? So in regards to that, because it's been communicated, of course, that information is gold, for the police department as well, and for the city investigating all these, horrendous tragedies. Can you elaborate, or for the chief, about any increase in the community providing tips, in terms of seeing those progress I'll
give a couple of examples, and the chief may have some. There was a young man, for example, that was shot getting off the school bus, right? Yes. We would have never caught that person had the community not stepped up. And there's been a couple of other items where we wanted to identify individuals, and the community has stepped up. One in a shooting, the media probably just got it, I think it was like 2 weeks ago. So we're seeing cooperation. We need a lot more. And I'll let the chief weigh in on this. One of the places where we're not seeing tons of cooperation, and I would like to see more, is from individuals who have been shot. They go to the hospital, and oftentimes, they have fear of reprisal, so they don't want to speak up as much. So we have to find ways to be able to do that. Or if a large crowd was around, they may not want to say anything. But I think even in some of those cases, you're seeing people wanting to speak. Now, there's a lot of statutory issues that I won't get into now that sometimes can make someone not want to speak up, and who can blame them. But I think that we are starting to see people speak up, because, like I said, they're sick of it. Chief, I don't know if there's anything you want to add.
And Chief, just a secondary component of that as well, if you could highlight any services that are in place with the Rochester Police Department in terms of protection for people that are looking to provide tips or information.
Sure. First of all, anyone who wants to provide information can remain anonymous. There's the Crime Stoppers number for that. You can always call 311. You can call 911 and ask to speak to an officer or an investigator. As far as the community coming forward, we have many more inroads to make with our relationship with the community. And, when Deputy Chief Keith Stith came on board as Deputy Chief of Community Affairs, he asked me, how do I define success for him? And my answer to him was that whenever we have a crime, no one is afraid to come talk to us, and everyone tells us what they have to say, is my definition of success for him. Now, obviously, that's lofty. It's going to take some work to get there. But he hit the ground running, and I think you're going to be seeing some great efforts on the community affairs side from us very soon.
Okay, man. I'll take two more, then I got to wrap up.
I have a secondary question for the chief, if that's okay.
Yep, sure. Chief?
So can you talk about the partnership between you and Child and Family Services when you get on scene? What's that process look like with kids who are involved?
Sure. Well, we have many different partner agencies. Obviously, our first go-to is the PIC team. And oftentimes they then reach out to other agencies for us on their behalf. Many times, obviously, we're busy dealing with the criminal aspect of it. But there are so many support agencies out there. You know, I mean, anyone who's looking for help or needs help, there are certainly resources out there for them. You know, especially for the children. We also work closely with the Bavona Child Advocacy Center for Child Victims. It's a long-standing relationship and a good relationship that helps us. The county fit team sometimes helps out when PIC is unavailable, because they're sometimes short as we are. And again, it used to be we would carry a community resource manual with us when that came out. It was a little book of all the resources. And actually now, fortunately for us, we have PIC, so we go through PIC and they know who would be appropriate to go through in those cases.
Can I just have a question for you, Ms. Huntington? So as we know, some of these victims are very young. 8 months to 18 is a very long time. How do you continue to support those kids that are victims of gun violence or have seen family members' lives taken due to gun violence?
Well, in those type of cases, there are two things that we can do. One is to make sure that we are encouraging and supporting families in getting any needed care for those children. We want to make sure that families are educated about why counseling and ongoing care is important and necessary. Once we're able to do that through continued conversations and relationship building, we want to make sure that we provide the necessary referrals and make sure that it's easy for people to navigate through the systems and they're aware of what our community can offer them.
And therapy is expensive, for anybody. How can they continue to get support if they don't have the means necessary?
Well, one of the ways that we initiate the process is by working through the Office of Victim Services, who can provide families with funding for counseling, and then we'll help families access it through other areas, whether it's insurance or through other types of plans that are available through some of our community partners.
Okay, last one. Anybody got any last questions? Oh, yes. Oh, you good? No, okay, he's good. All right, everybody's good. All right. Happy Thanksgiving, everyone. If I don't see you, and stay tuned, more to come. Thank you so much. Thank you.